Hi, I'm Alex, but many call me Dr. Mama Bird. I'm a wife, a mom, a chiropractor, and maternal health care advocate. After a traumatic birth experience that led to an unplanned C-section over 6 years ago, I found myself searching for answers on how to heal. Even though I was in the maternal health care space myself, I found it difficult to find the resources needed to truly recover and restore my body. After 2 years of research, I found myself pregnant with our second child and was able to have an amazing redemptive VBAC birth experience with my dream team. After that incredible experience, I felt God had placed on my heart a mission to help other mamas and families have a similar redemptive experience. And in time, with my husband's help, we developed the C-section restoration method. On this journey, we've met a ton of amazing healthcare providers that are often considered hidden gems in the Dallas area. Now, as a part of that mission, I'm here to connect you and other families with the incredible healthcare providers who are passionate about supporting you and helping you to achieve your family's health and wellness goals. I'm Dr. Alex Pancoke, and this is the Dr. Mama Bird Show. Alrighty, welcome everyone to the Dr. Mama Bird Show. My name is Dr. Alex Pancoke, and today I am super excited because we have one of my favorite guests on today, one of my really great friends, but also she is an amazing person. She's a wife, she's a mama, she's also a business entrepreneur, businesswoman. She is a functional medicine practitioner as well as physical therapist. And she also happens to be former Miss Black Nevada and a model. So she's just an amazing person all around. I'd love to introduce y'all to Dr. Danielle Bailey.
Thank you so much for having me. I'm so glad to be here.
I'm so glad you are here. I cannot wait to chat today because today we're going to be talking about a topic that a lot of times gets missed in our healthcare, which is specifically how to handle our healthcare as women or our health as women, and from a perspective that may be different than what we are used to or in conventional healthcare. As a functional medicine practitioner, Dr. Danielle helps women who are sometimes struggling with different conditions or frustrations that conventional medicine isn't really giving them the answers to. So she helps them to get really clear on what that is. And I'll let her describe more to us. But go ahead, Dr. Danielle. What is functional medicine and what does that look like?
Yes, so functional medicine is basically an area of medicine in which we really look at the root cause of why someone is experiencing certain issues. So instead of just checking something off the box, we look deeper to find out what's going on and how we can help and support those underlying issues so that people can really achieve optimal wellness.
Awesome. I love that. And as a chiropractor, getting down to the root cause is one of my favorite things to do. So what are some ways that you get down to the root cause? Or how about let's take a step back. What are some of the things that women will typically come to you that they're concerned with or frustrated with when it comes to their own health?
Yes. So I have several women that come in and they're saying, I'm experiencing some hair thinning, or I feel very, very moody all the time. I don't understand why. My hormones feel like they're just out of whack. I'm not sleeping well at night. Maybe I'm struggling with weight loss. I've tried everything. I've gone on all these diets. I'm exercising, and I'm still not shedding a pound. These are some examples of why women come in. A lot of them may come after they've had a baby, for example, and they just want to get back to their normal self, and they're just struggling to get back to where they were before having children. So a lot of times they'll come because they want to feel great and they've tried everything and they just can't achieve those results.
Yeah, that's very common. I'm sure a lot of our viewers who are watching today are like, yep, that's me. I've done all the things. I've had the blood work. I've had the labs. Everything seems normal, but I don't know why I don't feel good in my own system, in my own body anymore. Can you share with us a little bit more about what about functional medicine is such a different approach that allows for you to make these types of lasting impacts in somebody's health?
Yeah, absolutely. So first I'll say, there is a value in conventional medicine. We all need it. With functional medicine though, our goal is to take a little bit more time with the patient. So instead of just looking at your lab results, for example, we won't just say, oh, everything looks good, you're in range. We really look to find out what's optimal for the patient. So that's just the first thing. We really want to make sure that we're not just, again, glancing over lab values, but really saying, is this optimal for the patient? The other thing that we do in functional medicine is we really take a holistic approach in terms of not only looking at labs, because we can order labs, but we also look at lifestyle. What is your lifestyle like? Are there some stressors that are going on that contribute to some of the symptoms you're experiencing? We look at diet as well. Are there food sensitivities that someone might have that could be triggering some of those symptoms? We look at gut health. We also look at someone's supplements. Let's say they're on supplements that they feel that they were recommended to take. I look to see what type of supplements they are. Are these supplements really nutritive? Where is the sourcing coming from? Because that's really important as well. So we look at lifestyle, we look at environment, we look at diet, and we really want to take this holistic approach to really help patients achieve their optimal wellness.
Awesome. I love that. And I had a brief stint of diving into functional medicine with you. You inspired me, and I was like, this is really interesting. Yeah. And then I realized it wasn't for me, because one of the things that I love about it or appreciate about it, my brain just didn't work in that direction, was it is actually quite complex, right? Yeah. So like versus getting your traditional labs that you might get your blood work done and saying, okay, I'm in range. You're not, like you said, you're not just looking at what's in range, but what's in range for this person, and then how does that compare to multiple other different types of labs. I remember looking at this chart on one of the tests we might talk about in a little bit, and it was just so complex. It was like this, like, and all the things connect, and it looks like a spider web, especially when you're looking at your feminine hormones and how one little thing can be off, and it can just cause this huge cascade effect. And a lot of times the treatment is not super complex, but it's getting to what is the problem that requires a skilled and trained eye that I just commend you for, because I looked at it and I tried it and tried to go into it, and then I realized that's not for me.
Yeah.
So I was so grateful to be able to refer patients to you to do that.
Absolutely. It is very time consuming because we do take time to look at those lab results. We take time to find out, okay, how is this breaking down in the body? What pathways is this person exhibiting, and how can we kind of change and alter these pathways in the body to help patients really feel well and understand what's going on? So it does take time. Again, it's not just oh, you're good. It's okay, this is what's going on. These are the pathways that you're presenting in your body, and these are some things that we can do to change. And that's when people really begin to experience, a sense of feeling better, because now I looked at the root cause. I'm able to support what my body's going through, and through that process, I feel much better.
And that's just one pillar, right?
Right.
You also mentioned you're looking at people's food intake, their supplements. I remember I worked, like I said, in my brief stint of learning more functional medicine, realized as a patient was using something that was nutritive and good, but she actually happened to be sensitive to, not realizing she was allergic to something that was supposed to be helping her. And that was one of the things that was causing her to flare up even worse and not get better. And so it's also a completely unique and individualized approach. It's
Absolutely.
not like, here's a protocol.
Right.
You fit this box, do this protocol. Can you share with us a little bit more about that?
Yeah, that's kind of the beauty of it. It's, I've had patients that'll call in and say, well, what will I take for this? What do you need? What would you recommend for this? And I'm like, well, everyone's really different. We're all individual human beings, and we all have, our DNA is different. So it's not going to be the same that it was for this person it is for this person. It's very, very customizable, which makes it successful in terms of really tailoring the protocol for the person individually. I'll give an example. I had a patient, and we went through all these different tests, and we improved a lot of things, but she still wasn't feeling her best. And so I said, you know what? Let's recommend you to a mental health therapist. So I recommended her to a licensed professional counselor. And it wasn't until after she was going, or while she was going through her counseling, that she began to feel a difference in her health. So that's just key to functional medicine, in that, we collaborate with other providers, because you may need some other work, and I can't do the mental health part, but I can definitely recommend someone for you. And so it was through that experience, she had her counseling, and she was like, you know what? I'm realizing I'm feeling a lot better. There are a lot of things that were manifesting itself physically, and it wasn't until I got that help that I began to really notice the effects of the other work that we had done with labs and diet and everything like that.
And I love that you bring that up. I know that your mom is a licensed professional counselor
Yes.
as well. And mental health is such a huge piece of how we overall function. There's a book, I can't remember the author, but it's titled The Body Keeps the Score, and it really does. And so sometimes the root cause, the trigger, is an emotional trauma or a situation versus a physical trauma or a chemical trauma, or there's a whole host of things that can be causing our systems to be off, anything from mold in the house to food sensitivities. And then you can, in chiropractic school, we talked about a dog can have fleas and ticks too. We're not dogs, obviously, but there can be multiple things that are at play. And that's what the beauty of what you do is, it sounds like, is really looking at every single thing, how it all integrates, and providing a holistic approach, sometimes with other providers in hand. Absolutely. So I'm curious, what, I know you do labs, it's a big pillar of what you do. What's different from the labs, or what type of labs that are you doing as a functional medicine practitioner that you might not see in a conventional medical practice or family practice?
Sure. I'll give an example for hormone testing, because I do see a lot of women. They may say, I had my hormones checked with my doctor and everything was in range. And I say, okay, well, let me share with you a test called the Dutch test. It stands for dried urine testing for comprehensive hormones. Yeah. And this test is a little bit different. It's not a blood test. It's actually done through urine, where you can urinate in a cup, dip the filter paper in the cup, or you can urinate on the filter paper directly. And through this process, it looks at metabolites, which is how hormones break down in your body. So again, we're not just looking at the range. Oh, you're in range, you're out of range. We look to see, how do those hormones break down, and how can we help support how these hormones are breaking down? And through that process, we're able to really help people feel better with their hormonal support. And so that's one example of a test that I do that's a little bit different than what you would find with a conventional doctor. With the Dutch test, what's really fascinating about it is we can have some insight as to, okay, here are some things that you may want to incorporate more in your diet. Or what does your stress level look like? How are you sleeping at night? That's another key indicator on the test. Maybe you have, high cortisol at night, and that's affecting your ability to get good, restful sleep. And so through the Dutch test, we can look at all these different types of things. There's also some biomarkers in the test. Some women may say, I notice my hair is thinning. And so we can look, here are the markers that are present in the Dutch test for you specifically that's causing your hair to thin. Here's how we can support that. So it's very comprehensive. It's not just you're in range, again, out of range. It's here's how things are breaking down. Here's what we see are some triggers that might be induced by inflammation and how we can support that. And here's some tips on how we can maybe have good hygiene with sleep, as well as, how our day looks and how cortisol can affect our stress level throughout the day. So it's very comprehensive, it's very informative. And of the women that I see after going through a Dutch test and getting on a good protocol, they feel phenomenal. They feel excellent because we really were able to support the root cause.
Awesome. I love that. And that's the test that my brain was like, that's not your expertise, Alex. Go where you work well. And so I remember looking at my own Dutch test and looking at different tests and learning how to interpret it. And it's very individualized. It's very complex. Like you said, like what is, for those who don't know what metabolized means, it means essentially like what your body is actually breaking down and using. So you could do a blood test, right? And you could say like you're looking at estrogen. Well, there's several types of estrogens that we produce, or several types of progesterones and other hormones. And you might be in range, but if you're not breaking it down, that could lead to estrogen dominance, correct? If you're not producing enough, or it's out of balance, that's where the Dutch test really shines, is it allows people to see, okay, we aren't just looking at like what's just free floating in the system. How are we actually using what's in the system? Yeah. Which is really beautiful. But that's also just one of the many tests that you typically would run on a patient, correct?
Absolutely. So there's another test I like to use it's a type of DNA test. So it specifically looks at your genetics. And with that particular test, it can give insight as to why someone may, for example, struggle with fertility, or why they may have issues with losing weight. We can look at your DNA specifically to say, oh, this is what's going on in your DNA. We may want to try this diet instead. All these fad diets that are out there, they're not really specific to the individual. So some people just try them hoping that they will work. Yeah. But with the DNA test, we can look at your DNA specifically and give you some really good support and helping and guiding you to figuring out, this is the type of diet I should be on. These are some foods that I should be avoiding because with my DNA, my body can't process it as well. Yeah. And so that's another example of a DNA test. There's lots of DNA tests out there, but with functional medicine, we have DNA tests that are a little bit more in depth, a lot more in depth in terms of how to really guide patients and help and support them in their health journey. So that's another example of a test that we use in functional medicine. I'll give another example of a stool analysis. You can go to your doctor and get a stool test, but there's going to be a lot of different markers that are not available or tested with the ones you may get from your traditional physician. And so with a functional medicine type test, we look at other things like inflammation, parasites, all these different things, bacteria levels. That's just kind of a nutshell what we can look for in a stool analysis, which is a little bit different than what you might find with a traditional stool test from a doctor. So it goes a lot more in depth, which is very helpful for patients. And again, it allows the treatment to be customizable. And I'll even mention with a stool test, I've had patients before where I've done stool tests and I'm like, you know what? You actually need to go see a GI specialist because it's beyond what I can do. And you need to really find out more what's going on. And so at that point, we'll refer to a conventional GI specialist to help support the patient. So it's just helpful all around because yes, we get to the root cause, but then again, if we need to refer out because it's not under my scope to provide the care for the patient, we can establish a great relationship with a GI specialist that can do additional testing and support for the patient.
And that really makes you more than just, the doctor, but more of a coach, right?
Yeah.
You see a lot of your clients in more of like a coaching capacity or role to where they're receiving more than here's your labs, here's your prescription, more so here's what's going on. Let's get to the root cause. Let's talk about how we can change your health, your lifestyle if we need to co-manage with another provider. That's what I love about your practice is I know when I refer somebody to you that they're going to get what they need or you're going to get them where they need to be and then make sure they're with the person they need to be with, which I think is just so awesome because a lot of times we can get a referral to this doctor and then we're like, get a referral to this doctor and navigating our healthcare can be really difficult and challenging if you're not in the world. It was challenging when I was in the world. That's how I ended up getting more into what I do with C-section recoveries, like not knowing how to navigate, and I was in it. And so I think I love that that's what you do, and very intentionally here in DFW is establish relationships with providers that you can have that two-way communication to make sure people are really getting the care that they deserve.
Yeah, absolutely. Yeah, absolutely. And it's just beautiful because that's how we can help our patients, If it's just about me and what I can do, then I'm depriving them of really achieving the results that they need for themselves. And so it's great to have those connections with other providers in the area because we're all about the patient. So, yeah.
Can you share with me a little bit more about what is one of your favorite cases or patients or people, let's say people, that you've worked with and their results?
Yes. So one of my favorite patients was...
No HIPAA, right?
No, I won't mention the name.
Yeah, sorry, I didn't throw that out there.
Yes. One of my patients was struggling with fertility.
Yeah.
And so she came to me and was like, I'm really struggling with this. It's been several years since we've been able to get pregnant, and I really would like to have another child. And so we did a full intake, which our intake when a patient comes in is pretty lengthy. It's about 90 minutes to 2 hours. So it's not, a quick 15-minute appointment. We really take time to just understand your history, what's going on, and really customize a tailored plan. So with this patient, she was struggling with fertility, and we did tests like the Dutch test. We did a stool analysis. We also looked at her DNA, and we looked at food sensitivities because what were some things that she may not have been aware of that was affecting her body, may have been triggering inflammation that could have been affecting her ability to conceive. And so, and I will say this too, with functional medicine, it's not just an overnight thing. Sometimes it might take 6 months, sometimes it might take a year. Yeah. And so with this patient, it actually took a little over a year, but she got pregnant. Yeah. And so she's due, I think, in a couple of months now. Oh, and sometime as you. And it's just so rewarding to be able to witness things like that, because, you know, as you're trying to build a family and you want to conceive, it's a challenging issue for a lot of women, but through our functional medicine services, we were able to help this patient get on her health journey and get pregnant, and she's going to be having her baby in a couple months. So I'm really excited for her. But that was one of my favorite stories of being able to help a woman conceive. That's beautiful. I love that. And there's so many different things when it comes into conception, and a lot of moms, that is an area of challenge, or moms who want to be moms, or secondary infertility can be a challenge as well for quite a few families. And I love the holistic approach, because a lot of times people will come to you after they've tried all of the things, right? They've done IVF, they've done this, they've done that, and they still have that hope, which is so beautiful. And to be able to provide them that opportunity, another alternative, or maybe they start with this first, right? And to look at that. I know we're talking about women's health, but do you ever work with men as well? Sometimes, you know, fertility specifically, it's a two-way street, right? Yeah. So I've worked with men, not specifically for fertility, but I've seen a lot of men that have had things like a lot of gut issues, things of that nature. I haven't specifically had a client yet for fertility, but you are correct in that it is not just the woman. It is important for both the man and the woman to get tested and get supported, because that helps to optimize fertility. But most of the men that come to me either have some type of major gut issue, maybe they're experiencing a lot of joint pain, maybe they've lost a lot of weight and they can't understand why. These are the types of symptoms that most men would seek me out for, that I've had in my experience. Awesome. That's so good to know. Yeah. And I think it's very interesting. It's not, you know, we are talking about women's health, but it's not always just the woman who needs support. And one thing that I share often is, when you start looking at how your body is functioning, you start looking at health in general, things across the board start to work better. So I always give my patients a disclaimer when I refer them to other providers who work in a functional space, where you're looking at how are things working together, how do things are things synergistic, or where is some potential breakdowns. Just beware, you might get pregnant. That's what happened with me. With our second, I started some functional medicine postpartum after my first one. I was like, man, dealing with C-section recovery and rehab, and I still didn't feel great. It was hair loss. Things were all over the place with my mood, and just not feeling well in general, and starting on the functional medicine journey. And before we know it, there's baby number 2. Yes. And so, and baby number 3. Yay. And so I always tell people, when you really start to focus on how do we get the body healthy, which is the focus, right? It's not just treating the symptom. It's not just, hey, like, yes, we want you to feel better, for your health, to see improvement in your symptoms. But when you're looking at functional medicine, you're really like, here's a system. How do we optimize this system to function the way it was designed? Yes. What support does it need to get it back on track? And then the beautiful thing is, all of a sudden things just kind of start falling into place. And Absolutely. You're like, you do one thing, and now it's like, boom, this beautiful ripple effect. Yeah. Typically, taking a medication for most cases doesn't actually do it. It might solve that problem, or it might cover the problem up, but it doesn't have that same transformational effect. Yeah, exactly. I had a patient recently, a male patient. I'll say for males, do have some males that really want to help support their hormones. They feel like their libido is very low, which is another issue women experience too. But for men specifically, that really does affect them. And so I had one patient, and he said, I really would just like to get something for my testosterone. And I said, well, of course I can give you a supplement to support that, but until we really get down to the nitty gritty, let's look at your gut health. Do you have a leaky gut issue, which is where, your intestinal lining is not sealed nicely. And so you get this leaky gut issue where food particles just kind of go through your intestinal lining and it causes a host of several issues. I said, let's kind of take a step back before you jump into getting a supplement for hormone support. Let's really look at your gut health. Let's take a look at that first. Let's solve that issue, get you nice and strong there in your gut health. And then let's see how you feel. You may begin to feel really better with your hormones where you don't need a supplement for hormonal support. So I'm glad that you brought that up. It's so true. There is a ripple effect. Once you really help support the root cause, things just begin to fall in place.
Yeah, that's beautiful because the body is designed to triage problems, right? And so, we got to breathe. We got to be alive first. And there's different levels of how your body is going to prioritize its resources. And so reproduction is not at the top, or it is at the top. It's not foundational. Like staying alive is important. And so, and there's all these different steps in the middle. And so if we are, waning somewhere in the bottom or the foundation of our overall health or in the middle of our overall health, your body's not necessarily trying to reproduce or allocate resources to that specific system the same way it's going to reprioritize other systems. Like you have to get nourishment. If your gut's not healthy, you're not getting nourished. Your body's going to prioritize that system over reproductive system. It's going to prioritize, there's several different systems. Our cardiovascular system, we got heart's got to beat, right?
Yeah.
So sometimes getting in the bottom and cleaning up those things all the way up the pyramid of your systems will clean things up upstream as well.
Absolutely. I like to share, the illness wellness paradigm where what continuum are you on? Are you more towards the illness side or the wellness side? As we age and as inflammation kind of wreaks havoc in our body, people can move towards the illness side of things. And so by really being able to even be proactive, maybe you're not even experiencing, symptoms where you're like, I don't really feel anything. It's a good idea to just, say, hey, let me check my gut. Let me see what's going on with my gut health. Let me see if I'm sensitive to any type of food, or maybe I just want to learn a little bit more about my DNA. That gives a lot of insight on how you can support your body so that you're moving more towards the wellness side of this paradigm versus the illness side. And so I encourage patients to, because our bodies are magnificent in its way to help heal and triage things, as you mentioned, it's really good to just be proactive, get the support you need, find out what's going on, even if you're not really having aches and pains or you're having symptoms. And so that's an encouragement that I give to many people. Just be proactive, find out what's going on.
And give it time, like you mentioned. Give it time. Just like working out in the gym, it doesn't happen overnight as much as we would love. Bodybuilders spend years just to work towards one show. They don't go just once to the gym. They spend a lot of time. It's the same thing with other aspects of our health, whether you're trying to, create a specific physique or you're just wanting to improve your overall health. Just know that it takes one day at a time and give yourself grace in the process. Speak a little bit to that.
Yeah, I think that, especially I'll speak for moms who are, postpartum. You've had this baby, you've carried this human being, and your body does feel different. I'm a mom of 4, and so I get it. But giving yourself grace, understanding, I carried this child for almost a year. I say almost a year because we say 9 months, but I feel like it's closer to 10 months, and that's closer to a year. So you've carried this baby for almost a year, and you want to give yourself time. Give yourself time. The more we stress out about, I want to get back to this way I used to feel, being in CrossFit or something like that. The more you put stress on yourself to do that, I feel like it hinders you really from being able to achieve the results you want because you're stressing yourself out, feeling like I have to beat this timeline of getting to where I want to be. So give yourself time. Your body went through this process. These hormonal changes happen, structural changes happened, and we just have to give ourselves the time. Your body will get there. Give yourself the grace, love on yourself. Because once you do that and you give yourself that space to say, I'm going to go through this journey of recovering and getting myself back to where I want to be, you'll begin to notice your results kind of just escalate much faster.
That's beautiful. I love that you share that. And, it just speaks to my heart being pregnant right now, knowing that it's a journey.
Yeah.
Having done it a couple times now, it is a journey. It's not like 6 weeks and you're ready to go. It's more like 18 months before you start to feel human again.
Yes.
And that's when the real fun can start. Really, because you also have to consider, like you said, like sleep and all these other pieces that go into the dyad of being a mom and taking care of a child. And it's so crucial to, like you said, give yourself that time and that space to be able to really heal and recover, which is something that unfortunately sometimes Instagram forgets to share with the rest of the world. That we like to prioritize the snap back into that body kind of situation, which just is not realistic. Right. But I'm just, this conversation has been so enlightening. We could go on for hours on so many different rabbit holes and trails. I would love to end on, how would somebody find you if a mom's watching this right now and she's like, man, like I've tried all the things and I'm ready to like really get some, not just results, but understand what's going on with my system better and get a customized plan of care using functional medicine. How would they get a hold of you?
Yeah, so you can go to my website, www.360hws.com. And on the website, there's a little tab at the top where you can schedule a free discovery call. So before you even decide if we're a good fit and if functional medicine is the route you need to take, we will have a 30-minute free discovery call where I'll get to hear a lot about you, your goals are, what symptoms you're having, and through that, we can decide if we're going to move forward with functional medicine. So I highly encourage, just book a free discovery call with me, and through that discovery call, we'll be able to discover what's going on with you and how we can move forward with functional medicine. So that website again is www.360hws.com.
Awesome. Thank you so much, Dr. Danielle.
Yes, thanks for having me.
We're so grateful to have you.
Thank you so much.
And if you didn't know it, you are loved. You cannot earn it. You cannot lose it. We are here for you. We want to be here for you, but there are so many people that you may not realize that are just in your circle rooting and cheering for you, and we'd love to be on your team for that.